Urine formation is a crucial process that happens in the kidneys. These bean-shaped organs are essential for removing waste and maintaining balance in the body. Each kidney contains about 1 million tiny units called nephrons. Nephrons are the functional units of the kidney and play a key role in urine formation. Nephrons filter blood, reabsorb useful substances, and excrete waste. This process ensures that the body gets rid of what it doesn't need while keeping what it does. Understanding how urine forms can help us appreciate the complex yet efficient way our bodies maintain balance. In this essay, we will explore the steps of urine formation. We will also look at how hormones regulate this process and why the composition of urine matters. Finally, we'll discuss the clinical importance of urinalysis in diagnosing diseases. Urine formation is not just a simple task. It involves various stages and parts working together. Each section will delve deeper into these fascinating details. The nephron is the kidney's functional unit and consists of several parts. The main components include the glomerulus and the renal tubule. The glomerulus is a tiny ball of capillaries where blood filtration begins. Surrounding the glomerulus is the Bowman's capsule, which collects the filtered fluid. Connected to the Bowman's capsule is the renal tubule. The renal tubule has three main sections: the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule. Each part of the tubule has a specific role in processing the filtrate. The proximal convoluted tubule is closest to the Bowman's capsule and reabsorbs essential nutrients. The loop of Henle dips into the kidney's medulla and helps concentrate the urine. The distal convoluted tubule is the last section before the collecting duct, where final adjustments to the urine are made. Understanding the nephron structure is crucial for grasping how urine forms. Each part of the nephron contributes to filtering blood and creating urine efficiently. Glomerular filtration is the first step in urine formation. Blood enters the glomerulus through the afferent arteriole. The pressure in the glomerulus forces water and small molecules out of the blood and into the Bowman's capsule. This filtered fluid is called filtrate. The glomerular filtration process is selective. Large molecules like proteins and blood cells stay in the blood because they are too big to pass through the glomerular membrane. Small molecules such as water, glucose, and ions pass through easily. This filtration step is crucial for removing wastes and excess substances from the blood. However, it also means that useful substances need to be reabsorbed later, which occurs in the next steps. Overall, glomerular filtration ensures that the blood is cleaned and excess waste is removed. This step sets the foundation for the subsequent stages of urine formation. After filtration, the filtrate moves into the renal tubule, where tubular reabsorption occurs. Tubular reabsorption is the process of reclaiming useful substances from the filtrate back into the blood. This step primarily happens in the proximal convoluted tubule. During tubular reabsorption, essential nutrients like glucose, amino acids, and ions are reabsorbed. The cells lining the proximal convoluted tubule have tiny hair-like structures called microvilli that increase the surface area for reabsorption. This ensures that the body retains vital substances. Water is also reabsorbed in significant amounts, especially in the loop of Henle. The descending limb of the loop of Henle is permeable to water, allowing it to be reabsorbed into the surrounding capillaries. Tubular reabsorption is a critical step in maintaining the body's balance. It ensures that essential nutrients and water are not lost in the urine, but are instead returned to the bloodstream. Section 5. Tubular secretion. Tubular secretion is the next step in urine formation. During this process, waste products and excess substances are secreted from the blood into the renal tubule. Tubular secretion primarily occurs in the distal convoluted tubule, or DCT, and the collecting duct. Substances like creatinine, hydrogen ions, and potassium are actively transported into the tubule. This helps maintain the body's acid-base balance and removes additional waste products that were not filtered initially. Tubular secretion also plays a role in regulating the body's electrolyte levels. For instance, if there is too much potassium in the blood, it can be secreted into the tubule for excretion. This step is essential for fine-tuning the composition of urine and ensuring that waste products are effectively removed from the body. Tubular secretion complements the filtration and reabsorption processes to maintain overall homeostasis. Section 6. Regulation of urine formation. The formation of urine is tightly regulated by hormones. Two key hormones involved in this process are antidiuretic hormone, or ADH, and aldosterone. ADH is produced by the hypothalamus and released by the pituitary gland. It increases water reabsorption in the kidneys, reducing urine volume. Aldosterone, produced by the adrenal glands, promotes sodium reabsorption in the renal tubule. This leads to water retention and helps maintain blood pressure and volume. Another hormone, atrial natriuretic peptide, or ANP, works in opposition to aldosterone by promoting sodium excretion. These hormones ensure that the kidneys adjust urine formation based on the body's needs. For example, when dehydrated, ADH levels increase to conserve water. When blood pressure is high, ANP helps reduce it by increasing urine output. The hormonal regulation of urine formation is crucial for maintaining fluid and electrolyte balance. Without these hormones, the body would struggle to adapt to changes in hydration and blood pressure. Section 7. Urine composition. Urine is composed of various elements, primarily water, which makes up about 95% of its volume. The remaining 5% consists of solutes such as urea, creatinine, uric acid, and electrolytes like sodium, potassium, and chloride. Urea is a waste product formed from the breakdown of proteins. Creatinine is a byproduct of muscle metabolism. The presence of these substances in urine indicates that the kidneys are effectively removing waste from the body. Electrolytes in urine help maintain the body's electrolyte balance. The kidneys regulate the excretion of these ions to ensure proper function of muscles and nerves. The composition of urine provides valuable information about the body's metabolic processes and overall health. It reflects the efficiency of the kidneys in filtering and excreting waste products. Section 8. Clinical significance. Urinalysis is a common diagnostic tool used to assess the health of the kidneys and other organs. By analyzing the composition of urine, healthcare providers can detect various conditions and diseases. For example, the presence of glucose in urine may indicate diabetes. High levels of protein could suggest kidney damage. Blood in the urine might be a sign of infection or injury. Urinalysis involves several tests including visual examination, chemical analysis, and microscopic examination. These tests provide comprehensive information about the urine's physical and chemical properties. The clinical significance of urinalysis cannot be overstated. It is a non-invasive, cost-effective method for early detection of health issues, allowing for timely intervention and treatment. Section 9. Kidney stones. Kidney stones are hard deposits made of minerals and salts that form in the kidneys. They can cause severe pain and discomfort when they move through the urinary tract. Urine analysis can help identify the composition of kidney stones and guide treatment. Kidney stones often form when the urine is concentrated, allowing minerals to crystallize and stick together. Common types of kidney stones include calcium oxalate, uric acid, and struvite stones. Preventing kidney stones involves staying hydrated, reducing salt intake, and avoiding foods high in oxalates. Medications may also be prescribed to prevent stone formation. Understanding the formation and composition of kidney stones is essential for effective prevention and treatment. Urinalysis plays a key role in diagnosing and managing this condition. Section 10. Urinary tract infections, or UTIs. Urinary tract infections occur when bacteria enter the urinary tract and multiply. They can affect any part of the urinary system, including the bladder, urethra, and kidneys. Symptoms of UTIs include a strong urge to urinate, burning sensation while urinating, and cloudy urine. Urinalysis helps diagnose UTIs by detecting the presence of bacteria, white blood cells, and red blood cells in the urine. A positive nitrite test often indicates a bacterial infection. Treatment for UTIs typically involves antibiotics. Drinking plenty of water and practicing good hygiene can help prevent UTIs. Urinalysis is crucial for the accurate diagnosis and effective treatment of UTIs. Early detection and prompt treatment can prevent complications and ensure a quick recovery. Section 11. Diabetes and urine analysis. Diabetes is a chronic condition characterized by high blood sugar levels. It can lead to various complications, including kidney damage. Urine analysis can help monitor the health of individuals with diabetes. One of the key indicators of diabetes is the presence of glucose in the urine. Normally, glucose is reabsorbed in the renal tubule, but high blood sugar levels can overwhelm this process, leading to glucose excretion in urine. Microalbuminuria, the presence of small amounts of albumin in urine, is an early sign of diabetic kidney disease. Regular urine tests can help detect this condition early and allow for timely intervention. Urine analysis is an essential tool for managing diabetes. It helps in early detection of complications, allowing for better control of the condition